Hi everyone, welcome back to my YouTube channel. If this is your first time seeing this video or watching any of my videos, please do well to subscribe. If this is not your first time, thank you for always staying here with me. Trust me with the best content, trust me with the life-changing content, because I believe God will use me to bless your life. So today we are going to be answering the fifth question, and as usual, I will read out the question. How is your relationship with your lecturers? Do you have any lecturer you don't like? Ah, my relationship with my lecturers, I would say good. Yes, I think I would say good because I am someone that tried as much as I could while in school to maintain a very good relationship with my lecturers. But then it was not always like that until I discovered that I needed to actually like my lecturers for me to understand some things they teach in class. I'll start with my 100 level. During my 100 level, we had some lecturers that I don't really know much about them. I see them once in a while. 100 level first semester, I'm always trying to attend classes, go for lectures, stay in front, but it's not very easy because the class is always overcrowded with people and so many persons rushing to stay in front, and after everything you might end up not staying in front, you might stay at the back, you might be distracted. So 100 level, I didn't get to really know my lecturers personally, but then I don't have any relationship with them. I can't say I had any relationship with any of my 100 level lecturers apart from come to their class at the back, sit at the back. If I didn't see any space in front, I'll just stay at the back and then listen, make some jottings, and then study my books and then pass my exams. So 200, 300 level, it was just I was just there. I was studying. I didn't have okay. I liked one of my lecturer then, Dr. Kaufo. He's a consultant orthopedic surgeon, and yes, he teaches us anatomy. He was so good. I like excellence. So when I saw how excellent he was, I was like, wow, I like this lecturer. He was actually one of my best lecturers in preclinicals in anatomy. Then I liked Dr. Mozo, my physiology lecturer. He is so funny. Like, he comes to class, he usually revises for us, like towards our in courses, towards our MBBS. He comes to class and then he does revisions for us, and I always look forward to attending his classes because his classes are always fun. He starts with story, he ends with story. So it's I always remember Professor Granty. Who doesn't know Professor Granty in my set? Professor Granty, his big notes and all. So I loved his teaching method. So he would teach, he would tell us a story, and then he would teach again. So I loved his way, and then I always look forward to attending his class. I That's for physiology. For biochemistry, I loved Dr. Ofo. It's actually so easy to sit under him and learn because he loves teaching. So he wants to pour out everything he has in his head, like everything he wants to pour it out at once. So some students doesn't like that, but I think I loved his teaching method because he's a born teacher. If you listen closely, and you must be in front for you to follow him. So these are my these are my best lecturers in 200 and 300 level. I love them so much, the three of them. Ah. So 400 level, I don't really have much to say about this level, but all I know is that lecturers, they are good. Just that I think the level itself was not fair on my side. I think there is any lecturer that I had a relationship with, you know, I just the level was just there for me. It was just there for me. Can we just go to my best level in school? So 500 and 600 level, they are my best in med school. So my 400 level, I had my ops and gynae, my con-med, and then my pediatrics. So I'll start with my con-med. My HOD, my HOD comment is just like a mother to me. Dr. Ume, shout out to her. I loved her so much. I loved her so much. Let me not use loved because I still love her now. She's like a mother to me, and she's actually a very, very nice person. She teaches so well that she wants you to learn this. Like, she wants you to know this. I like all my commed lecturers. They are just good. Even though sometimes when I started commed first time, I was just angry. A lot of things to read and all, and it's just so out from, like, it's something like so out from medicine. So I was finding it so difficult to cope. But then with the kind of lecturers I had in commed, it was quite easy to fit in and to learn commed. Then for my pediatrics, so my pediatrics lecturers, I love them. Yes, I love them. The funny part is that the ones that people don't like are the ones I love. There is I wouldn't want to call their names, but then they are wonderful lecturers. Thinking about pediatric lecturers makes me want to laugh so hard. The way they teach, the way they teach, and the way they actually come for postings. It's funny, but then I like them. There's this particular lecturer that most students don't like. But the funny part was that I actually liked this lecturer, and his parts, like the part that he was covering in pediatrics, we are now my best because I just had to like him. So my ups and Riley, oh Jesus, I don't know, those guys, they were like fathers to me. I love them with all my heart. I love them. Shout out to Professor Ezebialu. Shout out to Professor Mobika, Professor Ikako, Dr. Ezenyako, Professor G, and Dr. Ubo, Dr. Ugunaya. Like, and then our CMD. One thing about my ops and gynae lecturers, our CMD will come to class with money. Anybody that gets a question, he gives them money. Anybody that gets a question, like, he encourages them. Like, I didn't know that there can be student lecturer relationship until I got to 500 level. You see that these people, like Professor Mubika, actually knows almost everybody in his class and the position they sit. Like, he'll be like, where is that girl that sits here, that wears glasses, that is on this hair? How can a lecturer remember his students like that? Sometimes it makes me so happy because I see in them fathers that wants that they are impacting you as their children, so they want the best for you. So ONG, like those lecturers, I will never forget them in my life. I love them so much, especially Professor Zebialo. Okay, I don't want to talk about my audio with all of them because before I started liking them, before I'm going to talk about it here. Sometimes the persons will actually tell you something that is bad, and then if you're not careful, you just hit them. The first day I went to Professor Zebialu's clinic, that day I went in there, and the first thing that he told me, he asked me a question about Combs test, direct and indirect Combs test, the difference. I was just entering, I was just coming for posting for the first time. We did Combs test in our 400 level, of course, in our hematology, but I forgot everything, was mixing them up. So he now asked me, did you pass 400 level? And I said, yes, sir. And I said, the 400 level results needs to be reviewed so that, because most of you here need to repeat 400 level. I was like, God, is this how ups and gynae is? I was so sad. But then after that day, the next day, after he insulted us, he corrected us and he taught us. So that day was something else. But the next day he was a bit calm. Then the next day, but we chop insults all the time. We do chop insults all the time. But then after the insult, the correction comes, But then the experience, if I think when I think about it now, I will just be laughing. Okay, I want to talk about Dr. Senyak. Anybody that served in FEM 3 in Chukwemeko Dimekwe University Teaching Hospital, Amaku, will understand that Dr. Senyak, oh my, he loves correct grammar. So the first day I was present to him, come FEM 3, I'm not in FEM 3. I was just sitting there because I had one of my mentors there. Angie, Dr. Anedu. Shout out to Dr. Anedu. He's in Fem 3, so I came to see him and he was not there yet, so I had to rest. And unfortunately for me, that was Dr. Ezenyako's office. So he walked in. Hello, students, can you collect this patient? So I'm not in Fem 3. He just shouted, he just asked, where are my Fem members? I said, I don't know, sir. Collect this patient. This patient I'm present. Oh, I went and collected the patient and I came back to present. That was my second week in Ops and Gynae. So I started presenting. He corrected me at every point, from the biodata to the presenting complaint to the history. Every step, he's correcting me. I was trying to say one thing. This man now stopped me. Do you know what he told me? Well, I don't blame you. I blame JAM for giving you admission to medicine. I don't understand the kind of student they give admission to medicine now. He dealt with me that day that I was just thinking about my life. I cried anyway. I cried. I was like, this man is so wicked. Never. I went home. I told my friends. I directed my audio to my friend, and everybody were like, "That's how he is." But then he's a very sweet man. I was like, I don't see anything sweet with what he just did to me. But then after some days, after some weeks, after staying with him, and then after attending his classes and all, I just discovered that he's actually a very nice person. So why did I even tell you all this story? It's just for you to know that don't judge your lecturers with what they say when they want to correct you. Anybody in medicine will understand that our consultants, they can tell you some things and then you will just start thinking about your life, but they just mean well for you. So just find a way to love them despite the way they talk to you, and then you will learn so well from them. I learned so well from them. O&G was my best department in med school, and then O&G and medicine. These two departments, they were my best. And the lecturers there, they are just like fathers to me, and I appreciate O&G lecturers and medicine lecturers so much. So that's by the way, surgery and medicine. I told you that 500 level and 600 level, they were my best in med school because they were practical classes, clinical classes, and the lecturers, oh my god, I don't know, they were selected and they were placed in that level. You just can't stop loving this set of people. So surgery lecturers, they are cool people. Medicine and surgery lecturers, I just want to stop here with medicine lecturers. My god, I didn't know that lecturers can be this, how will I put it? I'm just trying to find words to express how they made me feel. Is it Dr. Okoye that will tell you that will always come to class, ask a student to teach this particular, to present this particular thing, and then you learn from the student, ask you some questions. Their teaching method is just wonderful, and I love them so much. And then I cannot end this video without talking about Dr. Ugunze, like our respiratory consultant. That man is just something else. His classes, he will teach, and there was one story that will crack everyone up, and you just start laughing, and then he will come back and teach, and then oh my god, but then his exam is something else. Oh, I don't know how he sets exam, but his classes are beautiful. And Dr. Okoli. Do you know why I'm smiling? Dr. Okoli is just like one of my best lecturer in school. My best in school. 500, 600, from 100 to 600 level. I think he's my best lecturer in school. I so much appreciate him for. I've never believed lecturers can actually believe in a student the way he believed in me. He just knew that, oh yeah, you are just a very smart girl and you can do whatever you put your mind. Like I didn't know lecturers can be this good. But then kudos to my medicine lecturers, kudos to Dr. Okoye, kudos to now Professor Okoye, kudos to Dr. Koli, kudos to Dr. Gunze. God bless you all. I love my lecturers, yes. So I just want to summarize by saying this. You cannot hate your lecturers and do so well in school, especially if you are a clinical student. Come around, come to classes, try as much as you can to always attend classes. You get to know your lecturers when you attend their class. So attend their class, and love them. Don't hate them, please. Most times I don't like my lecturers. I normally fail their courses. I don't, not that I fail. Failure to me is when you get 60 something, right? So whenever I discover that I don't like this particular lecturer, I normally lose interest in whatever he's saying, and that brings down my results. But whenever I like this lecturer, I'm always eager to learn from him, and that helps my result. And one thing I do in med school is that I always attend classes. I don't miss my classes. I always try to attend classes. I always try to be in clinics. Please don't miss classes, don't miss clinics. You're a medical student, for crying out loud. So try to go to class, try to go to clinic. If you're not a medical student, try to always attend classes, try to always attend your practical sessions, try to know your lecturers, try to relate with your lecturers well. When there's something we call ophthalmo in med school, make sure your lecturers know you. Make sure they know you, because if they don't know you and you are coming for viva, they will just, like, they will ask you some questions, and maybe if they, the fact that they know you, that you come around, they will just, okay, let me just, even if you are failing, he will just give you like 5 or 4. But if they don't know you, they will give you 0. So please do your ophthalmo very, very well as a medical student. Make sure you go to the ward, go to the clinic, meet the registrar, and then get acquainted with most of them and let them teach you. Don't discard anybody. Even the house officers can teach you. Even the resident doctors can teach you. Your lecturers can teach you. The consultants can teach you. Try to love your lecturers. I loved mine, and I will never regret how my relationship with my lecturers went and how it is going now. Most of them will be attending my wedding. So thank you for staying to the end. This video, okay, this video, I don't know what to say. So thank you for staying till the end. Watch out for my next video next week, and I hope you stick around, subscribe, and do share. Drop your comments and let me know how you feel about my videos. Bye.